Hi, my name is Raul Sanchez, and today I will be doing a presentation with Chance on fish oil for this week's assignment. So first of all, I want to go over the assignment question. The first thing it says, describe and explain which specific biological process are affected by the medicine slash supplement, which is fish oil. What are the side effects, pros versus cons, and expenses for taking such products? What are some conditions for this product and how it is being marketed today? What is the targeted audience? Is it regulated by the government? Do you believe it to be a cure or a temporary band aid to a more serious problem? Do you believe that the medicine and supplement industry need to be regulated more stringently, or do you believe it needs to be lax somewhat? So before we start, I want to give a little bit of an overview on what is fish oil. Later on, Chance will be talking about this more. But fish oil is a dietary supplement and omega-3 fatty acid and is used for many functions. And some of these functions include muscle activity and cell growth. It has also been one of the earliest dietary supplements, and by the end of the 19th century was used as a treatment for many diseases. So what we know about this is basically that it has been around for a very, very long time, and it has benefited many people throughout the course of its discovery, and since it was being used in medical offices as well. And from there on, we have learned way, way more about it, with more science and more technology as well. So now what I'm going to be talking about is the biological processes affected by fish oil. So, um, a couple of there's three things that I'm going to be going over. So one of the processes that it affects is increased low density lipoprotein, which is LDL cholesterol. There are two types of cholesterols, and this is one of the better cholesterols, the one that we want more of. So that's why it affects it in a good way, as well as it also lowers blood pressure. Another thing that it does is reduce the risks of heart attacks. So I will now be talking about the side effects of fish oil. There are not really any side effects with fish oil, and the ones that there are very unlikely, first of all, and they're not very detrimental. They're very light side effects. So one of the most common one include fish aftertaste and bad breath. The next ones that I'll be going over aren't really as common and are all treatable with other things as well if it comes to happen. So heartburn, nausea, diarrhea, and rashing. But like I said previously, they are very uncommon and very unlikely for it to happen. So now I'm going to be talking about the pros that come with taking fish oil. So, fish oil can actually improve heart disease. Um, and if one fun fact is that if you take it at least twice a week, it can lower your chances of dying from heart rate. So what is interesting is that that's not even a big dosage. You're barely taking it, and just that simple act of taking fish oil twice a week can help your health and your long term life way more with just doing that simple thing. Also, it boosts your metabolism, which in cause starts you to lose weight if you're overweight, and it helps you have a healthier body from the inside as well. It also helps you with high blood pressure, like I said before, and it also helps with rheumatoid arthritis. So the last thing that I will be going over is the cons. Like I said before, is very light the cons. It's just the same as what we talked about in the side effects. Just that fish aftertaste, bad breath, heartburn, nausea, diarrhea, and rashing. And like I said, they're very treatable. And now I will be passing it over to Chance.
So these are the competitors for fish oil: Croda International PLC, Omega Protein Corporation, and BASF SE, as well as Pelagia AS. The target audience is healthy, conscious individuals, older adults, athletes and fitness enthusiasts, parents, those with health risk and disease. So fish oils, since you have so much benefits from the omega fatty acids, basically that you want to target people that work out, like most like bodybuilders and weightlifters, they all take fish oil. Most athletes take fish oil, if not all of them take fish oil, just because as well as eating fish and eating like marine life and things like that will help. If you just take fish oils, it's like a cheat code and kind of like a easier way of just getting straight to all the omega fatty acids that help your body like healing and things like that. The older adults, this just helps because you could get sick from so many different things. So having some of that stuff in you does help you from not only getting sick, but reducing the risk of all these diseases that you usually become more capable of getting as you get older. Athletes and fitness enthusiasts I got into, and then parents. Parents is a weird one because it actually is like a lot of moms take it when they're pregnant just because it's supposed to help your kid like the baby inside you. It's like it does something to where when the kid comes out, he's like he usually scores higher on certain tests and things like that. There's studies done and like it's supposed to make your kid healthier and smarter, which I mean like the stats and data behind it do prove it, even though it sounds kind of random. And those with health risk and diseases. So I personally take fish oil literally just because of my disease. Like when you get a disease, most of the time you become autoimmune, so you get sick like very quickly. And the thing with that is you have like nothing to really fight your body. So these fish oils kind of help with obviously all the other medicine you take. The fish oils help in like making your body stronger in terms of like vitamins and things like that. It gives you all these certain nutrients that you wouldn't get unless you eat fish and things like that. So it honestly is like a really big game changer for a lot of people that just want to be healthier and literally just taking fish oil. Medicine and supplement industry regulation. Oh, so has to be approved by agencies. This is all what they do right now for regulation. Has to be approved by agencies, clinical trials, approval process, post-market surveillance, and recalls. So honestly, I feel like it's pretty fair how it is right now because there goes through trials and things like that. Like, I mean, there's like phases. Like you go through like 6 phases, and there are year-long phases to really study and understand the drug. So I feel like they pump them out as they should. Obviously, the one that was really like the one that had everyone confused was the vaccine, but that's just because it came out so quickly. But I feel like when it's something where everyone's dying, you kind of have to like study it as much as you can in that little like small amount of time to get it out there to be safe. So I guess that's the one rare occurrence where you would probably be a little skeptical and think like, I don't know how well that was or how good of an idea that was to make that happen. But at the same time, like you gotta do what you gotta do when people are dying. Clinical trials, obviously, like I talked about, is really well. Approval process just goes into like getting it out there. Post-market surveillance. I like these two the most, post-market surveillance and recalls. Obviously, you don't want recalls to happen, but if it happens, at least you're doing it so no one's still taking the drug and becoming sick. This shouldn't help him with fish oil just because it's sort of like fish oil. It's like so it's just there to help you. It's not like it's not a medicine band-aid like we could get into. It doesn't cover up for anything really. It just is there to make you feel better and healthier. Then the recalls, obviously, yeah, you just don't want that out there. And then um okay, there. I was wondering. So fish oil overview. Knew that fish oil and omega fat. This is basically how it started right here. Like how fish oil came about was that they knew that fish and omega fatty acids were good for the body and disease. There wasn't like a thing where they're like, oh, we need to like fix this. So what should we do? It was kind of like we know what we get from marine life. We know there's certain nutrients and things that you get. So like, can we extract that stuff and make it into a pill? And so that's what it was with fish oil. So they knew that fish and omega fatty acids were good for the body and diseases. Did studies to see what diseases the fish oil would benefit, see how what it reduced. It reduced a lot of different things, like like right here, released realized it reduces the chances of heart disease, which they did studies on brain health, inflammation, joint health, and skin health. Those are the big ones that fish oil help, and they all got these from doing like well, not surveys, I guess like tests, like phases, and they study the people parents take during birth as it has good effects on the baby, like I talked about. Sorry. And then a lot of patients with diseases or autoimmune take this as a safety net to keep the body healthy. That's what the big one is now is they give out fish oil pretty frequently with your other like I guess medicines and stuff like that, just because it helps the body, just it makes it easier on the body to take in all that stuff. And these are our references, and thank you.